If you've had one immunization, your chance of it being effective is 93 to 95%. With the second immunization, it's up to 97 to 99%.
And that's good news for people who have been vaccinated for measles. But for people who haven't, health officials in central Illinois are putting out a big push for you to do it. Good evening, I'm Jessica Coons. This all comes as 2 more cases of the measles have been identified in Champaign County. Champaign County Public Health says those people aren't infected anymore. We told you about 2 cases that were reported earlier this month. Now a 3rd and 4th have been added to that list. The 3rd identified person was in quarantine for the infectious period. The CDC is doing some more testing on the 4th. If someone has been exposed and was not vaccinated, they need to call the measles hotline before going anywhere. Hospitals have also set up areas for people who are unsure of their immunity status and have been exposed or have symptoms which are very similar to the flu.
You know, it's kind of tricky because we're still in the midst of our flu season, but if you start developing a rash, that is much more concerning.
If someone were to have the measles, the main thing is supportive care, and I can't stress that enough. You need to make sure you're keeping your fluids up. If you have fever, treat that with an anti-fever medicine.
There's no cure for the measles, but as you heard, a single dose of the MMR vaccine is about 93% effective. Now, measles outbreaks are popping up across the country as well. More than 100 people in at least 10 states are sick, and it has some raising questions about state policies that let parents opt out of the vaccines for their kids. Fewer than 2% of Illinois school students are unvaccinated. More than 20,000 students are exempt. If school kids aren't vaccinated and they do not have a medical or religious exemption, they are removed from school. We spoke with a pediatrician at SIU in Springfield who cautioned against misinformation that spreads online.
And if you don't get the vaccination, you're not only putting your own child at risk, you're putting other children at risk. I think that's the most important thing. It's not just a personal decision. It's a decision which affects other children who can't get immunized or have other serious underlying illness.
Once again, that vaccine about 93% effective, which means you won't get the disease if exposed. So chances of a full-blown epidemic are not high for central Illinois.